While the Marburg virus has not been confirmed elsewhere in the country since Abraham Wambale, a health worker from Mengo Hospital, died of the disease, its impact is visible at Mpigi Health Center. In the outpatients department, the chairs, the beds and the rooms are empty, with no health workers in sight. This is the biggest health facility in the district, normally attracting hundreds of patients daily, but they're now scared of coming since Wambale was treated here shortly before his death. Most health workers who got in touch with Abraham are now being monitored from home. The ministry officials always come and take their samples. Margaret says, a great initiative, but it has left the health center with just a handful of health workers. Over 10 are being monitored for Marburg, including the officer in charge. When the NTV team visited the health facility, we found just 2 health workers. Margaret was helping with deliveries and Lydia Nansambi in the general ward. I was on leave when Abraham died of Marburg, so I never got into contact with him. I'm the only one tending to patients in the general ward, she says. There were only 2 patients here, mainly for fear of the deadly viral disease, but also because others walked away due to the absence of health workers. The Minister of Health has just learned of the challenge at Mpigi. What are you going to do about that? That's a government institution. I know Mengo is a private hospital. It can cater for itself. It can fill up the gaps. What are we doing about it as Minister of Health?
We have actually got that report. The worst one was them stopping the patients from coming. When we are informed this morning, we are mobilizing a kind of a backup. We can get some few people who can help them.
In the meantime, Health Ministry's Permanent Secretary Dr. Suman Lukwago says some health workers will be brought from other health centers to help out in Mpigi until the health workers in quarantine are set free.
The right procedure of isolating the other health workers is the correct one, because in case one of them turns to be positive, we don't want them to spread the disease to the population.
Marburg is highly contagious and mainly spreads through contact with the bodily fluids of an infected person, including corpses. The Minister of Health, with the help of MSF, CDC, UNICEF and other partners, has contained the spread of Marburg, with only 5 suspected people exhibiting some signs of the viral disease and about 150 contacts awaiting clearance. Florence Nalimba, NTV.